Pectus is one of the most common congenital chest wall deformities. It occurs in about 1 to every 300 or 400 patients. It's more common in men than women, but I think probably a lot of women have it too and just don't realize because they carry more subcutaneous fat on the chest wall. I get a lot of communications from patients saying, do I have pectus? And there's such a huge variety in the way pectus presents. The most common ones are the concave, which is the excavatum, and the carinatum, which is protruding outwards. There are a million different mixes of those in between, and it's very important to have a physician that understands and knows pectus to look at you and decide whether you truly have pectus. The other thing that I'm very frequently asked is, if I have pectus, do I need surgery? Does it need to be fixed? And what is going to happen to me if I don't get it fixed? That's a complicated answer, and in order to really look at it, we have to do testing to see, is the deformity medically impacting you? Patients will have symptoms such as shortness of breath. They'll feel like their exercise tolerance is different than others, that their friends keep going and they kind of peter off and aren't able to finish out. Many symptoms and many different things, sometimes pain, sometimes tachycardia, but other things can also cause that. So part of our analysis of your pectus is looking at what are the medical implications. That includes CT scanning, exercise testing, echocardiograms to look at the heart, EKGs. We have a whole team here who will do testing, will together look at all the information and make a decision about whether surgery is right for you. There are a number of ways to do surgery. Most commonly, we use the minimally invasive, which is similar to braces. We place multiple stainless steel bars to elevate and lift the chest. There are some other videos which can show you more details about the surgery, but our first step is to get you worked up, to get our team to see you, and let's put together the information to see whether your pectus is something that needs to be operated on or not.
Hi, I'm Kelly Myers. I work with Dr. Dawn Jaroszewski at the Mayo Clinic as her program coordinator for Pectus program, and I'm here to walk you through the steps through registering and testing needed in regards to getting a surgical recommendation from her. The first step that we want to go through with looking into the journey here at Mayo Clinic with your pectus deformity is going on to the mayoclinic.org website. And through this website, there's multiple things that you can check which are going to be important to you when you're looking into surgery with Dr. Jaroszewski. The first item you want to do when you're looking into a recommendation here is going through the patient care and health information site and going down to the patient visitor guide. When becoming a patient for Dr. Jaroszewski, the main campus that you would like to focus on is the one in Arizona, which we are located at. And from the website, go to the Mayo Clinic campus in Arizona. On this page is where you would go ahead and register and request an appointment with Dr. Jaroszewski. So request an appointment at Mayo Clinic campus in Arizona. You click on the link that is for U.S. patients or international patients, depending on your demographics. And from here, you request an appointment, and you would include all your specifics with your insurance, demographic information. But again, remember when you're looking at Dr. Jaroszewski and our Pectus program here in Arizona that you select the Phoenix and Scottsdale campus. On the Mayo Clinic website, when you're looking at insurance and your specific insurance, especially being out of state and coming to Arizona for services, you use the mayoclinic.org website again. You can go down to the patient visitor guide. And from this site again, go ahead and select the Arizona campus because each campus is different. And we go down to the area for billing and insurance. You can find out more about specific plans that Mayo Clinic in Arizona are contracted with, which is a important key for your process in being seen in Arizona with Dr. Jaroszewski. So at this point, select contracted health plans, which will give you a list of current plans that are in network with Arizona. And then you can go from there if you're seeking insurance also to see which kind of plans you would be wanting to purchase down the road for planning. Once you're registered and we've reviewed all your records or have seen you in person for an evaluation, you can always return back to the mayoclinic.org website and log in up on the right-hand corner as a patient and use your Mayo Clinic medical record number and log in. You'll be able to view your medical records, your testing that was done at Mayo Clinic. If you've chosen to have all your testing completed here, you'll have access to those. You'll have access to Dr. Jaroszewski's recommendation and her evaluation. This is a good source also for billing if you have any questions in regards to charges that have occurred while you were visiting Arizona. One of the questions that we get asked here at Mayo Clinic in regards to our Pectus program and Dr. Jaroszewski's time is what kind of time expectations you have as a patient. Currently, our evaluations are being booked out about 2 months, depending on the testing that you do and your choice of either having a chart review or an evaluation with Dr. Jaroszewski. In most cases, you can have testing completed at Mayo Clinic within 2 business days with having the appropriate test, which we'll go over in just a minute. This is an example of my record keeping that I kind of keep track of everybody since people are coming from all over the place and testing is not completed all at one time in some cases when you're doing it at home. So I kind of keep track of the tests that we need to do, and I'm going to just walk you through some of the information that I really need in order to keep things organized and consistent with Dr. Jaroszewski. The first thing is going to be basically your name, date of birth, the medical record that you've established with Mayo Clinic, what type of defect you have, and your current phone number. If you're a new patient starting out and do not know what kind of tests were needed, the testing and the records that are required for review in order for a surgical recommendation from Dr. Jaroszewski is the list here. So you want to have an echocardiogram, and for that we need the echo report. We need an EKG or an ECG, which is also a printout and a report for your sinus rhythms. The CT scan or MRI, either of those tests are done without contrast, and we have a Pectus protocol for these scans which is used, and once we contact you and kind of establish care, I can provide those for you for assistance if you're going to have those completed at home. And once those are completed and reported by the radiologist, we want a copy of the disc with the images on it and the report from the radiologist. The last test that we do look at for Pectus excavatum and for Pectus carinotums is the cardiopulmonary exercise test. This test is referred by many other facilities differently, so we are more than happy to help you locate somebody close if you're having that done local also. For patients who've had previous surgeries for their Pectus defect, we would want a copy of any operative notes that they have that they can obtain along with the date of surgery. And if you currently have any hardware as bars or plating in your chest, we'd also like to have current x-rays for the front and side view. For some patients, if they have metal sensitivity, and this is something that is not needed for every single patient, but if you find you've got some sensitivity or allergies, we'd like you to complete a metal allergy test and include that report. The last checkbox I have to give Dr. Jaroszewski for review of your symptoms. So if you have the symptoms, it's nice to make sure that she's fully aware of it if you're not going to be meeting with her in person. So these are some of the symptoms that we have with the Pectus excavatum and some of the Pectus carinotum patients. So once we have all the testing completed and records needed, you can get everything together, which is helpful if you have them all in one, to include all the reports along with the disc and send them to the address to Mayo Clinic to Dr. Jaroszewski at the 5777 East Mayo Boulevard in Phoenix, Arizona, and the zip code is 85054. After all your testing is completed and we receive your records or we have seen you in clinic for an evaluation, at that time we determine when surgery would be scheduled, and at this time we're booking about 6 to 8 months out, and that's all depending on Dr. Jaroszewski's busy schedule. Another question we get once surgery is determined, and if that is a recommendation, that we are asked, how long would you expect to stay in Phoenix? So the time frame that we want you to stick around would be anywhere between 7 to 10 days, and that's including coming in the day before your pre-op visit and staying for a day or two after your post-op visit. Once everything is completed with your testing and your evaluation with Dr. Jaroszewski or your surgical recommendation, we'll go ahead and start the planning process for scheduling surgery. The last consideration you want to have for visiting Arizona is that we are highly populated with tourism during those winter months, and the summers may be more economical. Thank you for following us through the process on the registration and the testing that's needed for a surgical recommendation. We will look forward to receiving those records in either having a chart review or an evaluation. And once that's completed, we look forward to seeing you.